Welcome to the deep dive. Today, we're doing exactly what it says on the tin, diving deep into a stack of sources you've brought us.
That's right. We're aiming to get a really comprehensive handle on a critical issue: urban transport in Ghana.
We'll be looking at the huge challenges, the impacts that maybe aren't always obvious, and potential ways forward.
Yeah, and we've got quite a mix of material, some really detailed academic papers, complex modeling, trying to put numbers on health impacts, cost-benefit analysis.
Right, the heavy stuff.
But also really crucial on-the-ground reporting, stuff that captures what it's actually like day to day and the politics around it all.
So our mission here is to pull out the key insights, maybe some surprising bits, connect those dots, and give you a clear picture. We'll focus a lot on Accra, naturally, it being the capital.
But we'll also bring in findings from other areas, like the Atkoman-Wabiakia municipality study you found, which gives some specific local context too.
Okay, so it's data meets lived experience. Let's get into it. The problem first. Navigating Ghana's gridlock.
Yeah, if you've ever been in Accra, or frankly many growing cities, during peak hour, well, you know what we're talking about. It's more than just slow.
It can be soul-destroying, can it?
Absolutely. The sources really paint that picture. Commuting described as, frequently frustrating, often just plain dreadful. We read about one person, Nikami.
Ah, yes, the Kasoa commute.
Exactly. Traveling from Kasoa, which is quite a distance outside the city center, into Accra, sometimes leaving at 5 a.m.
5 a.m.
and not getting to work until 10 a.m.
That's 5 hours, one way. Just think about that. 5 hours of your day just gone, sitting. What else could you do at that time?
It's an enormous personal cost. And it's not just an anecdote, the numbers back it up. One source estimated the average daily travel distance in Accra is around 27 kilometers.
Okay, 27 kilometers.
And for that distance.
Okay.
The average commute time was pegged at 58 minutes.
Almost an hour. For less than 30 kilometers, that tells you average speeds are just crawling, especially when it matters most.
Totally. And the frustration that comes through in those news reports, it's palpable. People are just tired. Tired of the delays, the unpredictability, the sheer exhaustion.
Understandably so. So, what are the sources saying are the root causes? It sounds like a mix of things.
Oh, definitely not just one thing. It's like a perfect storm. A big one is just the sheer number of vehicles. Explosive growth.
More cars on the road?
Yeah. Ghana's economy has grown,
Yeah.
There's a burgeoning middle class, and car ownership has surged. For many, a car feels like the only reliable option.
But the roads haven't kept up.
Not even close. You're adding all these vehicles to a road network that just wasn't built for it and isn't expanding fast enough. And this is happening alongside rapid urbanization. Cities like Accra are sprawling outwards.
So people live further away.
Further and further away, but often still need to get into the same central business district, the main economic hub.
More cars, longer distances, all funneling into the same places. And what about public transport? Does that play a role?
A huge role. The sources are pretty consistent here. Public transport systems, buses, tro-tros are often seen as inadequate, substandard even.
In what way?
Limited reach, they don't go everywhere. Unreliable schedules, inefficient routes. Sometimes the quality of the vehicles isn't great. And this lack of a good alternative effectively pushes people into buying private cars or using taxis or motorcycles, even if they might prefer public transport otherwise.
It's a vicious cycle, isn't it? Bad public transport means more cars, which means more traffic, which makes the public transport stuck in that traffic even worse.
Precisely, and underpinning it all is a lack of sustained investment in proper mass transit. Things like dedicated bus systems, maybe light rail down the line.
Beyond the vehicles and roads, are there other factors? Management?
Yeah, inefficient traffic flow management comes up. Things like traffic light timing, poor enforcement of traffic laws, people just not following the rules.
And the state of the roads themselves, I saw mentions of potholes.
Definitely. Pothole-riddled roads, inadequate maintenance. That slows everyone down, damages vehicles, makes things less safe.
That Atkoman-Wabiakia study you mentioned earlier, it got really specific, didn't it?
It did. It broke down the causes in that municipality. They pointed to the sheer volume of traffic, obviously, but also inadequate routes, not enough ways to get places, unauthorized parking, just blocking lanes.
Ugh, that drives me crazy everywhere.
Tell me about it. Ongoing construction, messing things up, vehicle breakdowns causing chaos, faulty traffic signals, and then driver attitude, aggressive driving, not obeying signs, and even poor road design contributing to the problem.
It's a long list. And that study also tried to link this directly to the economy, right? To productivity.
Yes, and that's crucial because good transport isn't just about convenience. The sources are clear. It's fundamental for economic growth. It connects regions, enables trade, local and international. It gets workers to jobs, goods to markets, supports logistics, everything.
It's like the bloodstream of the economy, if it's clogged.
The whole system gets sluggish. A good transport system lowers the cost of doing business. Less travel time, less fuel used, more comfort for commuters, so they arrive ready to work and safer transit for goods and people. Especially vital for things like perishable goods.
Right.
One source puts it simply: transport infrastructure investment is an input, GDP growth is an output. There's a direct link.
Can we put a number on the cost of all this lost time?
Well, one source tried to estimate the time cost specifically for Accra. They calculated that if, and it's a big if average road speed could increase by just 8 kilometers per hour.
Which doesn't sound like a massive leap.
No, but it would make a difference. If that happened, the value of the time saved, over 30 years, calculated as a net present value, was estimated at a staggering $311.6 million US.
Wow. Over $300 million just in time saved. Imagine reinvesting that or just people having that time back. That's huge.
It really highlights the economic drain. And that Nwabiaga study drilled down even further, looking at how specific congestion factors statistically impact low productivity.
How did they measure that? What did they find?
They used statistical modeling.
Yeah.
They found, for example, that changes in traffic volume significantly increased the likelihood of experiencing low productivity, arriving late, stressed, deliveries delayed, that sort of thing, for 22%.
So just more cars equals less productive workers, statistically.
That's what their model indicated, yeah. Inadequate routes, that increased the likelihood by nearly 30%. Unauthorized parking was a shocker.
How bad?
It increased the predicted chance of low productivity by almost 100%, like 99.8%.
It basically guarantees lower productivity if parking is blocking things up. That's wild.
It shows how seemingly small things can have massive ripple effects. Vehicle breakdowns increase the likelihood by about 30%, faulty traffic signals by nearly 20%. Even driver attitude bad driving was found to decrease the likelihood of high productivity, meaning it contributes to the problem. Poor road design too.
So it's infrastructure, maintenance, management behavior, all hitting the economy hard through lost productivity.
Exactly, and people feel it. That same study found that over 2/3, 67.5% of people in Nwabiaga were not satisfied with how congestion was being managed. It mirrors the frustration we heard from Accra commuters.
Okay, so the picture is grim. Awful commutes, choked roads, massive economic costs. But the sources also reveal this hidden toll, something maybe less obvious, the impact on health.
Yes, this is where one of the key research papers comes in, a health impact study for Greater Accra, using a model called IFM Global.
IFM Global sounds complicated. Can you break down what they were trying to do and how?
Sure. Think of it as a simulation tool. It helps estimate how changes in things like transport might affect public health outcomes. Specifically, they wanted to quantify the impact on deaths and something called years of life lost prematurely, YLL.
YLL, so how many years people lose from their potential lifespan because of these transport issues?
Exactly, how much life is cut short. To do this, they built a synthetic population for Accra.
Like a virtual city?
Kind of. A statistically representative model based on available data, mainly a 2009 time-use survey. Now, they acknowledge limitations. The data is a bit old. They had to borrow some parameters from studies in Indian cities where local data was missing.
Okay, so not perfect data.
No, but crucially, they built uncertainty analysis into their model. So while the precise numbers might change with better data, the overall direction of the findings, which scenarios are good or bad for health, is considered pretty robust.
Right, so they have this virtual population. What did they test?
They set up different scenarios. A reference scenario showed what might happen if current negative trends continue, specifically people shifting from using the bus or walking towards using cars more.
Which we already discussed is happening.
Right. Then they modeled alternatives, shifting long car or taxi trips to the bus, shifting short car taxi trips to walking, shifting short motorized trips to cycling. They define short as 0-6 kilometers, long as 10 kilometers plus.
And for each scenario, they calculated the change in exposure to 3 main health pathways.
Exactly. Physical activity levels, air pollution exposure, specifically PM2.5, and the risk of road traffic fatalities.
Okay, this is the core of it. What did they find? How do these shifts affect deaths and lost years of life?
The results are really quite striking. Let's start with that reference scenario: more cars, less walking, and bus use.
The negative baseline.
Compared to the 2009 baseline, this scenario was estimated to cause over 400 extra deaths and more than 20,500 extra years of life lost. per year.
Per year. Wow, that's a huge public health burden just from more people driving cars.
And it's driven by, well, increased exposure to the bad stuff, air pollution, higher crash risk, and losing the benefits of active travel. Now consider another scenario. What if some of that motorization shift was specifically people moving from cars to motorcycles? Okada, basically.
Using bikes to beat the traffic. Seems logical.
Maybe logical for speed, but for health. This was the worst scenario they modeled. It resulted in nearly 370 additional deaths and over 18,500 YLL per year. And that's on top of the harm from the reference scenario.
Even worse than just more cars. Why?
Primarily due to a massive spike in road traffic fatalities. They estimated fatalities among motorcycle users would increase fourfold in that scenario. The risk per kilometer on a motorcycle is just fundamentally much, much higher.
Okay, stark warning there. More motorization is bad, shifting to motorcycles is even worse, mainly due to deaths. What about the positive scenarios? Shifting to the bus.
That was the big winner. The scenario shifting long car taxi trips over 10 kilometers to the bus was estimated to avert or prevent more than 600 premature deaths and over 31,500 YLL per year compared to that negative reference scenario.
Averting 600 deaths, gaining over 30,000 life years annually. That's incredible. That really shows the potential health benefit of a good bus system.
Absolutely. And again, the main driver for this huge benefit was the reduction in road traffic fatalities, getting people out of relatively riskier cars and taxis and into generally safer buses for those longer distances.
Okay, what about active travel? Shifting short trips under 6 kilometers from cars or taxis to walking or cycling? Surely that's good for health? More exercise.
You'd think so, wouldn't you? And in many places it is. But here's a really crucial, perhaps counterintuitive finding from this Accra study. Those scenarios, while increasing physical activity, showed no net significant health benefits in their main analysis.
No net benefit from walking and cycling more. How can that be?
Let's break it down by those pathways again. First, physical activity. Accra actually have a high baseline level of activity already. People walk a lot as part of daily life, about 9 hours a week of moderate activity on average, walking to the market, to the tro-tro.
Right, it's often necessity.
Exactly. So the additional activity gained in these scenarios was relatively small compared to that baseline. The study does note that losing the current walking would be bad unless replaced by cycling. But simply adding a bit more active travel didn't drive major health changes on its own in their model.
Okay, so the baseline activity complicates things. What about air pollution?
Air pollution got worse with more cars, reference scenario, and was lowest when shifting to the bus. The active travel scenarios didn't change it dramatically either way. It wasn't the main story.
Which leaves road traffic fatalities.
Bingo. This is the elephant in the room. The study found that changes in road traffic fatalities were the dominant factor driving the health outcomes in all scenarios. We're talking 80–90%. Even up to 99% of the change in deaths and YLL was down to changes in road crash risk.
So even if people walked or cycled more, any health gain from the exercise was basically wiped out by the increased risk of getting hit by a vehicle.
That's the stark finding for Accra in this study. When they modeled shifting short trips to cycling without assuming major safety improvements, they actually saw cyclist fatalities increase almost fourfold compared to the reference scenario. Even with a slight safety and numbers effect, the increased exposure just swamped any benefit.
So the huge policy takeaway here is, you can't just promote walking and cycling and expect health benefits if you don't tackle road safety first. Drastically.
That's exactly it. Road safety isn't just one factor, it's the prerequisite. It's essential for saving lives now, and it's essential to unlock the potential health benefits of active travel later. Otherwise, you're encouraging people into a dangerous environment.
Did the study's uncertainty analysis shed any more light? What data did they really need?
Yeah, the value of information analysis showed that the biggest uncertainties were around the road traffic burden calculations. Things like how many injuries actually get reported, what's the precise fatality risk for walking versus cycling versus motorcycle versus bus in Accra.
So better crash data is critical.
Absolutely. But even when they ran sensitivity analyses, assuming overall road safety was better, the active travel scenarios still didn't show a clear net health benefit unless there was a massive direct reduction in fatalities specifically for pedestrians and cyclists. It just kept coming back to road safety being paramount for those modes.
So summing up the health part. Shifting long trips to buses looks very beneficial, mostly by cutting road deaths. But just encouraging more walking and cycling for short trips won't work health-wise without massive safety improvements, because road fatalities are the overwhelming health risk right now.
That's the crucial nuance. Safety first, then active travel benefits might follow.
Right. Okay, we've really untacked the problem, the jams, the economic drain, the health crisis driven by road danger. Let's shift to solutions. What do the sources suggest?
Well, one major potential solution that gets analyzed in detail is a bus rapid transit system, or BRT. We had that cost-benefit analysis focusing on expanding BRT in Accra.
BRT, what exactly is that again? And hasn't Accra tried this before? I recall the Ayalolo buses.
Yeah, BRT aims for rail-like efficiency, but with buses. Key features are dedicated lanes, so buses skip the traffic, proper stations, maybe pre-board ticketing, real-time info. The goal is to make it faster and more reliable than driving. And yes, Accra has history here. The news source mentions Ayalolo struggling and the NDC party pledging to revive it. The BRT study itself also notes a previous attempt faced big cost overruns, especially with some infrastructure like a bridge, and wasn't fully rolled out. So yes, challenges in the past.
Okay, so what did this specific analysis propose?
It looked at expanding the system. Big investment in infrastructure, those segregated lanes, terminals, a bus depot, better pedestrian access. Also, smart traffic management, like giving BRT buses priority at signals and strengthening the institutions needed to run it all smoothly.
Sounds expensive. What were the estimated costs and benefits, say, over 30 years?
Costs first. In net present value, the initial investment was about $80.6 million USD. Operational costs, fuel, maintenance, wages, etc., added another $132.5 million NPV.
So yeah, total costs over $210 million NTV.
Okay, over $200 million. What about the benefits they could put a number on?
Two main ones were quantified. By far the biggest was time savings, estimated at $311.6 million USD NPV over 30 years. That's basically valuing the time people wouldn't spend stuck in traffic because of the BRT.
The same number we heard earlier as the cost of congestion, now framed as a benefit. Exactly. Valued using estimated urban wages. The other quantified benefit was averted carbon emissions, but that was much smaller, around $6.5 million NPV.
So the economic argument hinges massively on saving time. Were there other benefits they expected but couldn't quantify?
Yes, several important ones. Increased safety was a big one. Fewer accidents expected because people might switch from riskier modes, like motorcycles. And the BRT system itself would be designed for safety with trained drivers. Also, lower vehicle operating costs for individuals or even tro-tros if they switch.
It's interesting, though, that safety wasn't quantified in the BRT benefits, given how central it was in the health impact study.
That's a really critical observation. The BRT study authors acknowledged this. They said existing data on BRT safety impacts elsewhere is mixed, and crucially, they lacked reliable local safety data to link this specific intervention to accident reduction. They explicitly stated that better data on things like current tro-tro use, pedestrian movement, and detailed crash statistics is needed for a fuller picture, including a proper financial analysis, which also wasn't possible without fair revenue data.
So, based on what they could measure, did the BRT expansion look economically worthwhile?
They used the benefit-cost ratio, BCR. If it's above 1, benefits outweigh costs. At standard discount rates, like 5% or 8%, the BCR was above 1, suggesting it was feasible, but it dipped below 1 at a higher rate, showing sensitivity to financial assumptions.
What else was it sensitive to?
The biggest factor was the assumed increase in overall average road speed across the entire network, not just for the BRT buses. The analysis showed the project only really makes economic sense, BCR 1 at 8% discount, if it leads to at least a 10% increase in average road speed for everyone.
So the BRT has to be so good it actually pulls enough cars off the road to speed up traffic generally?
That's the underlying assumption for the positive economic case. It relies on mode shift reducing overall congestion, while the dedicated lanes keep the BRT itself attractive. It's a big assumption about changing behavior.
Okay, BRT is one major option, with caveats. What other solutions came up across the sources?
A whole range. There's the traditional approach. More investment in general road infrastructure, expanding networks, new lanes, flyovers, that sort of thing.
Build more roads.
Alongside that, the absolute necessity of maintaining the roads we do have, fixing those potholes.
Right.
Then, better traffic flow management. Tackling those obstructions like illegal parking or street vendors encroaching on roads. Enforcing traffic laws more effectively.
What about public transport beyond just BRT?
Crucial. The sources stressed developing a reliable, comprehensive public transport system, expanding bus networks, more dedicated lanes where feasible, integrating different modes so they connect smoothly. Reviving those struggling state systems like Metro Mass and Ayalolo is mentioned specifically.
Making the whole system work better together.
Exactly. Other ideas include promoting carpooling, maybe incentives or special lanes, and encouraging walking and cycling.
The act of travel again.
Yes, but with the huge caveat we discussed. It requires building safe, dedicated infrastructure-protected bike lanes, good sidewalks, and tackling cultural perceptions, maybe getting leaders to cycle, providing bike parking.
Making it safe, easy, and normal.
And interestingly, Accra's own resilience strategy, mentioned in the BRT source, suggested looking at upgrading the informal tro-tro system.
Really? How?
Things like better regulation, licensing, maybe setting vehicle quality standards, even helping owners finance upgrades. It acknowledges tro-tros are vital now, especially for affordability, and suggests improving them, maybe integrating them as feeders into a larger system.
Working with the existing reality.
Yeah. And finally, the news source touched on government policies trying to lower fuel costs, the Gold for Oil scheme, reviving the Timo oil refinery. Not direct transport fixes, but fuel prices affect everything.
Which brings us neatly to the politics. The news report really emphasized how central this is, especially around election time.
Definitely. Transport policy is big in the manifestos. Both the MPP and NDC have specific pledges for 2024, and smaller parties too.
We saw that example of the MPP shifting on road tolls. What are they promising now?
For 2024, the MPP mentions reviving Metro Mass, decongestion policies, promoting electric vehicles, and that Gold for Oil initiative for fuel costs.
And the NDC.
Historically, they focused on railways, water transport, road safety, and legalizing Okada. For 2024, pledges include reviving the Timo oil refinery, specific traffic decongestion plans, and bringing back the Ialolo buses.
So lots of promises flying around, but the commuters quoted in the news piece sounded, well, tired of promises.
Very much so. People like Samigima and Ikami, they basically said they've heard it all before. They want action, implementation, not just talk. There's skepticism based on past projects hitting roadblocks or not delivering.
And this comes back to a point that emerged from both the BRT study and the health study, didn't it? The need for a joined-up approach.
Absolutely. All the sources, one way or another, point to this. The BRT study says it explicitly. Transport needs a holistic view. You have to integrate urban planning, infrastructure building and maintenance, public transit improvements. Projects need to complement each other, not compete within a long-term strategy. The politics needs to move beyond just listing things to showing how it all fits together safely and effectively.
This deep dive really has shown just how complex urban transport is in Ghana. We've felt the grind of the daily gridlock, heard the commuter frustration, we've seen the huge economic cost, hundreds of millions in lost time and productivity, and we've uncovered that critical health burden driven overwhelmingly by road traffic fatalities, which fundamentally limits the potential of healthier options like walking and cycling right now.
Yeah, the sources make it clear this isn't just inconvenient, it's not just bad for the economy, it's a genuine public health crisis where the risk on the roads is a major barrier to progress.
And while solutions like better public transport BRT systems, maybe upgrading tro-tros hold real promise, especially by offering safer alternatives and reducing overall chaos, the research underscores that point. For active travel, like walking and cycling to deliver net health gains, safety isn't optional, it's the foundation. You have to make the roads safe first.
The potential benefits are enormous, but unlocking them depends on truly prioritizing safety in policy and planning.
So as we wrap up this deep dive, drawing on all these sources you've helped us unpack, here's the thought we want to leave you with. Considering the immense human cost, lives lost, quality of life diminished, the staggering economic cost, and the potential benefits laid bare by these studies, especially from tackling road deaths and boosting public transport, what specific coordinated actions, truly linking planning, infrastructure, safety, public transit, maybe even informal systems, could realistically shift Ghana towards that safer, healthier, more productive transport future? What does real progress, beyond the promises, actually look like on the ground?
That's the multi-billion-dollar question, isn't it? And the critical challenge for the years ahead.
Something for you to ponder. Thanks for joining us for this deep dive.
Thank you.